Hi, my name is Libby Rich, and I'm going to be discussing the effects of the DASH diet and hypertension. First, I'm going to begin by defining hypertension. Hypertension is commonly known as high blood pressure. It is a condition that affects the body's arteries. The force of the blood pushing against the artery walls is too high for the body to withstand over time. This image depicts the different states of the artery: normal, prehypertensive, and hypertensive. In the hypertensive state, there's a lot of buildup on the artery walls, which narrows the pathway for blood. This creates a lot of pressure within the artery. Unfortunately, hypertension is very common. In 2021, hypertension was a primary or contributing cause of 691,095 deaths in the United States alone. Hypertension is most prevalent in the southern states. Hypertension is defined by two stages. Stage 1 is a systolic blood pressure reading of 130 to 139 millimeters mercury and a diastolic blood pressure reading of 80 to 89 millimeters mercury. Stage 2 is a systolic blood pressure reading of 140 millimeters mercury or higher and a diastolic blood pressure reading of 90 millimeters mercury or higher. Stage 2 is far more critical. This image shows the different blood pressure categories: normal, elevated, high blood pressure stage 1, and high blood pressure stage 2, and a hypertensive crisis. Most people do not have symptoms associated with hypertension, but this condition cannot go untreated. Untreated hypertension can increase the risk of heart attacks, cardiovascular disease, strokes, and death. The treatment of this condition includes increasing healthy habits and, in more severe cases, medication. If one were to have symptoms, they would be headache, lightheadedness, shortness of breath, nausea, heart palpitations, bloody nose, or anxiety, but these conditions are commonly mistaken for something else. Although medication is available when needed, most people can treat their hypertension by changing their diet, exercising regularly, and quitting smoking and drinking. If medication is needed, some common hypertension drugs are diuretics, beta blockers, and calcium channel blockers. But most of the time, people can treat their hypertension by changing habits and exercising daily. How can we combat hypertension? Well, I looked at the DASH diet. The DASH diet is a recommended style of eating to prevent and treat hypertension. DASH stands for Dietary Approaches to Stop Hypertension. Foods in the DASH diet are rich in potassium, calcium, and magnesium: vegetables, fruits, and whole grains, fat-free or low-fat dairy products, fish, poultry, beans, and nuts, and are not high in sodium, sugars, or saturated fats. In this, we are going to take a look at why foods rich in minerals and not high in sodium are better for the body and treating hypertension. The science behind the DASH diet. This diet has been known to treat hypertension because it is low in sodium and high in important minerals. Sodium causes the body to hold on to water. The extra water in the blood puts additional pressure on the arteries, increasing blood pressure. You can see in the image to the right, the water retention causes the artery to swell. In addition to this, diets high in minerals treat hypertension because of their interactions with sodium. Magnesium competes with sodium for binding sites on smooth muscle cells, and potassium helps to excrete sodium in urine as well as ease tension in artery walls. Some foods high in magnesium and potassium are bananas, oranges, leafy greens, and broccoli. There is research that has backed up the DASH diet. The first study we are going to look at is the effects on blood pressure of reduced dietary sodium and the dietary approaches to stop hypertension, or the DASH diet. The goal of this study was to assess the effects of different levels of dietary sodium as well as the DASH diet on people with and without hypertension. The methods were 412 participants were assigned to a control group or an intervention group. The participants in the control group ate a diet typical of a person in the United States. The participants in the intervention group ate according to the DASH diet. Within each group, the participants ate foods with varying levels of sodium for 30 days. The study found that reducing sodium intake in both the control and the intervention group reduced the systolic blood pressure of participants. The DASH diet significantly reduced systolic blood pressure at every sodium level in participants with and without hypertension. This study suggests the DASH diet, as well as reducing sodium levels, is effective in lowering systolic blood pressure in those with and without hypertension. The second study is high fiber diet and acetate supplementation change the gut microbiota and prevent the development of hypertension in heart failure in hypertensive mice. The study aimed to assess the effects of different diets on the blood pressure levels of mineral corticoid excess mice. Mineral corticoid excess mice were split up into groups and given a control diet, a high fiber diet, or acetate supplementation. The study found that the high fiber diet group and the acetate supplementation group showed significantly reduced systolic and diastolic blood pressure, cardiac fibrosis, and left ventricular hypertrophy. The DASH diet is high in vegetables, fruits, and low fat dairy products. Since this diet is high in fiber, the results of the study are promising. The study suggests that high fiber diets reduce systolic and diastolic blood pressure. The third and final study we're going to look at looks at the association between high blood pressure and intakes of sodium and potassium among Korean adults. The Korean National Health and Nutrition Examination completed this survey between 2007 and 2012. The study aimed to find the association between sodium and potassium intake on blood pressure. Approximately 24,000 adults without history of antihypertensive medication were selected for dietary assessment. These participants completed 24-hour dietary recalls and were categorized into groups based on sodium and potassium intake. Sodium intake was positively associated with diastolic blood pressure, while potassium intake was negatively associated with systolic blood pressure. Foods in the DASH diet are rich in the minerals potassium, calcium, and magnesium, and low in sodium. The study suggests that this diet would be effective in treating hypertension since potassium decreases blood pressure while sodium increases blood pressure. In conclusion, hypertension is primarily treated by lifestyle changes. The consumption of fruits, vegetables, and low sodium foods has been seen to lower blood pressure. Therefore, the DASH diet has proven to be an effective method at treating and preventing hypertension.